Guys, welcome back to my channel. Today we are going to make another video about catheter removal. This is the skill station we do in the Osce exam. It is for 12 minutes as well. So let's start the video without any further delay. Thank you so much for watching and coming back on my YouTube channel, guys. It makes me happy. Start with the equipments that we need for catheter removal. We need alcohol gel, apron, syringe, 10 mils, non-sterile gloves, gauze, and then zero point 0.9 saline solution, and the yellow bag for the discard, for if we are going to discard all the things, right? We're going to discard all the things. So these are the things only that we need for a catheter removal. I always like to start my video with the marking grid. I don't say the things on my own. It's like from my own self. No, we follow the marking grid as it's mentioned in the marking grid. That's the only procedure we follow to make our videos. So if you haven't watched my video, my previous video, I made a video on inhaled medication. I made a video on MSU, all those video, catheter, specimen of urine, implementation. If you haven't watched, go back and then watch the videos. They are quite helpful. And today we are going to start we are going to make video removal of urinary catheter, as I said earlier. So in the marking grid is the pre-procedure, introduction, actual procedure, preparation of the equipment. No, first preparation of the equipment and then actual procedure. So if the examiner says don't do the pre-procedure check, don't introduce yourself, just start with the actual procedure, you're gonna start with the actual procedure, guys. Sometimes we are just in a habit of starting with the pre-procedure, but if you are home preparing for your OSCE, make sure that you practice starting with the actual procedure as well, to get familiarize yourself with this techniques, with the actual procedure. Practice makes a man perfect. Practice doing it starting with the actual procedure. So let's say in this section the examiner said no need to do pre-procedure, no need to do introduction. So you're gonna start with the preparation of your equipment. So how do you prepare your equipment for catheter removal? First of all, you're gonna maintain hand hygiene, check integrity and expiry of all the materials that you're using. I've mentioned in the beginning what are the materials that we need to use. Check if they are not opened, if they are not broken or something. Just check the expiry date as well. And then you're using the cleaning solution. Just clean the cleaning solution with the alcohol swab in one go, and then pour it into the gauze, into the pack of gauze, and then make sure that you don't touch the gauze or side of the sterile solution. So you're gonna wear your apron and your non-sterile gloves, and you're gonna wear your apron and take the things to the patient. When you enter the patient room, you're gonna when you enter the patient room, you're gonna clean your hands, wear your apron, and start the procedure. You need to check if they have any leg support. If they have leg support, you're gonna remove the leg support first for easier removal of the catheter. You're gonna check the urine if there is in the bag. You're gonna check and then tell the patient what's the content, how many mLs of urine is there, what you're gonna do about it, and then you expose the patient only the area that you need to expose. Now you will get a paper where it says 10 mils of urine, 10 mils of water was used to inflate the balloon. The first thing you're gonna do is you expose the patient. You tell the patient that it is written in your documents that 10 mils of water was used to inflate the balloon. I'm going to deflate the balloon. I've taken a syringe and then I'm going to deflate it. I've taken 10 mils. This is 10 mils, and then I will remove your catheter. So you're gonna make sure that you deflate the balloon completely before removing the catheter. So now you are in the explanation procedure, right? You're going to tell the patient that I'm going to deflate the balloon, and then I will ask you to breathe in and out, and then while you exhale, I will remove the catheter with a gentle and continuous traction. Just in a quick one, I will just remove the catheter right away while you exhale. This is just to relax the pelvic floor muscles. You're going to explain the patient, right? So I will remove the catheter gently but firmly with a continuous traction while you exhale. Of the catheter, you're going to clean the patient. You're going to tell the patient, I'm going to clean your urethra. I'll clean I've soaked some gauze in saline, that I'm going to take one one gauze, and then I'll clean from the meters from top to bottom in one go. I'll discard it, then I will clean one side of the labia from top to bottom. I'll bin it, and then I will do the same on the other side. And then after that you're going to explain to the patient that always clean yourself from top to bottom. Every time you use the you use the loo or you go to the toilet, clean from top to bottom, and then encourage general cleaning to prevent ascending infections, especially for the females. You're just giving them some teaching at this point. You've removed the catheter, ensure that they drink loads of water, because to prevent UTI, or because we just took off the catheter, so they need to drink loads of water at this point. Also encourage patient to exercise, and then inform them, like explain it to them, that when they go to the toilet for the first time after catheter removal, please inform any member of the staff, because we need to record how many mils of urine they passed. If you want to record the appropriate mils, I mean the correct amount, you can give them a bottle or whatever. You can give them a bottle, or what do you call it, the shields that we use. You can put in the toilet bowl, and then they can weigh in that, and then you can weigh it later on if you want to know the correct amount. If you're working in the ICU or anywhere else, or else you can go with the patient, ask them if they have weighed appropriate amount of the urine, whether it was small, medium or large, so they can tell you, and then you would know that how much mils of water they weighed in their first wee after catheter removal. So here guys, when we clean the urethra, like we remove the catheter, we bin the catheter and the bag, and then we're gonna discard the urine into the sluice room. We are not discarding it into the orange bin. We are going to discard the urine in the sluice room. You're gonna take off your gloves right away, and before starting cleaning the patient, before you clean the patient, you need to wear new gloves. You need to wear new non-sterile gloves. You can tell the patient that I'm wearing new sterile gloves and I'm going to clean your urethra. I'm going to clean your private area. I've exposed you a little bit, right? So I've removed the catheter. I'm going to clean your private part. I'll clean with from the middle first, then from the sides, and then you change your gloves afterwards. Then after cleaning, you give a health education. As I said earlier, dispose of the equipment you used, apron, gloves in orange waste bin, and then also that as you know, you're gonna discard gloves first and then your apron. Do we discard the urine into the sluice room, not into the orange bin? Because we don't want the infection to spread, right? To minimize the infection spread. And then also because we're gonna stay there, it will smell loads if you're gonna discard it in the orange bin. So make sure you always discard urine or stool into the sluice room, and then maintain hand hygiene throughout the procedure. Tell the patient that I've removed the catheter at this time. I'm going to document it into your notes, and then make sure you drink loads of water. And then I will also write and mention it to the doctor how many mils of urine was there into your catheter bag before I removed it. And if you have any queries, any question, please don't hesitate to ask me now or whenever you want. Now before you leave, you're gonna tell the patient that you're going to ask the patient if they're comfortable, if they need you to do anything, if they are in any kind of pain, if they need to go to the toilet or anything else they want you to do. You're going to ask them. Now we have ended the procedure. We discarded everything. We discarded all the equipments that we use. You're going to clean your hands, maintain patient is safe and comfortable before you leave, and you end your procedure. So here the important thing is health education that you do before removal of the catheter and after removing the catheter. Thing that you need to remember, what is the procedure of cleaning of the private part of the patient when you remove the catheter. If it's a female, as I explained earlier, you need to clean from the meters one side and the other side, and that's it. But if it's a male patient, how you gonna do it? You need to hold back the foreskin from their penis, and then clean with this one sterile soaked gauze from the we need to pull back the foreskin and then clean from the front and then from the back. And also you can tell the patient that they need to clean afterwards. When they go to the toilet, they need to wash their area thoroughly, because the catheter was there. We don't want any kind of infection to grow. So this is it for guys for the catheter removal. If you have any questions about catheter removal, please don't hesitate to ask me. Put it in the comment section below. If you like the videos, share it with your friends, give it a big thumbs up, and please subscribe my channel. I'll see you in the next video. Thank you for watching. Take care.